So if you're not watching them move and you don't understand why they have pain or lack of range of motion or weakness or stiffness or whatever at a specific angle of what they are doing, then you can't get to a treatment. So there's the big dysfunctional gap that school left you with. You don't know how to assess function. When you do assess the function, you don't know how to analytically whittle that down to here's what the problem is. Is this an eccentric contraction, concentric contraction? Is this lack of pronation? Is this lack of pronation control? Is this, you don't understand how to do that stuff. So then you can't come up with a treatment that's worth a crap. All right. So once you get their little subjective, once you go through a full total body screen, watching them function, where they fail, and understanding why they fail when they fail, and getting that done in less than a minute. So we're not doing the SFM, FSA, whatever screen for 45 minutes to an hour, because all that does is get you to a diagnosis. And then you go do your treatment plan protocol. So I have no idea why anybody would do the SFMA, SFFMS, whatever the hell it's called. I went to that course for 2 days and it was the biggest waste of time of all time because all they do is dump you back into the dysfunctional model. You don't learn anything about why that person is failing that screen. So you have to be able to understand how different people move because nobody's going to be the same. If you have 10 people come in with plantar fasciitis or patellofemoral syndrome or idiopathic low back pain, all 10 of them are going to have a different presentation once you get down to the root cause. They're going to have similarities, but they're all going to be different. So that's why if you just throw them into a protocol, 10% will do well with the protocol. They won't do phenomenal. They'll still have to come in twice a week for 6 to 8 weeks or whatever, but at least they'll progress slowly. The other 90% won't progress at all because the protocol totally missed what the problem is because you never got to what the problem is. All right. So the number one reason why you are frustrated and why you're failing with going from eval to treatment is because your eval is completely wrong and takes you down the wrong road. So then you're just grabbing for straws. So here's what people tell me. Well, I get done with my eval and then I don't know, like, should I do stretching with them or should I do myofascial release? Or should I do corrective exercises with them? Or should I do some other exercise, something else? Should I do cupping or needling? Should I put them in orthotics or should I do K-tape? Everything that I just listed there is a symptom modification gimmick that's not going to get you anywhere. Because they're going to come in and say, I felt better for a half an hour, and then everything came back, and then you're back reaching for straws. So what we're going to talk about in our Facebook Live coming up is going to be how to quickly get to the root cause of the problem in your assessment so that when you go from assessment to treatment, it feeds directly into the treatment. Your assessment and your treatment should be meshed together. So you should be going back and forth from assessment to treatment the entire time you're working on them. It's not, I ask them questions here, then I do objective measures here, and then I do a treatment here, and then I send them home here. That's why patients fail, because of that compartmentalized thinking. Everything should mesh together and run a smooth, steady line, okay? So next week, we're going to do a Facebook Live, and last time I looked, you guys want Facebook Lives to be on Wednesday, so look down in the poll down below and make sure you vote. So I put the Facebook Live on the day that you want it. I'm going to release the date of Facebook Live tomorrow afternoon, so make sure you vote between now and tomorrow afternoon so I can get the day that you guys want. And we're going to go over how you quickly get the information that you need that meshes directly with the objective assessment that you are going to do, which gets you directly to the root cause, which takes you directly to the treatment, which takes you directly to the therapeutic exercise, which takes you directly to the patient education. Everything works together instead of compartmentalized crap that gives you nothing but frustration and gives your patients frustration too. So get down below, make sure you vote for the day that you want. Then when I release that date next week, it will be at 5 o'clock my time, which is 7 o'clock Eastern Standard Time, and it's 4 o'clock California time. And for you people overseas, it's way off time. So maybe you'll watch the recording. I will record it and post it on Facebook. So just make sure you vote, and then make sure once I release that date tomorrow, you put that on your calendar so you can be there, and we can take a half an hour to 45 minutes to go through this instead of 7 minutes here. Talk to you then.